In this video, here's what we'll cover: how common anxiety really is, how stress and anxiety differ when it is time to get help, why avoidance backfires, the therapies that actually help. You know the feeling. You have left the office in the Norwest Business Park. You are inching along Old Windsor Road, and instead of winding down, your mind is speeding up. Tomorrow's meeting, the unanswered email, the school pickup you nearly forgot. Life in Bella Vista in the wider Hills district is comfortable. And it is fast. And for a lot of people that pace comes with a quiet, constant hum of stress and anxiety. If that sounds like you, here is the first thing worth knowing: you are in very good company. And this is genuinely workable. In my practice, I sit with people carrying exactly this every week. So let me walk you through the difference between stress and anxiety, what the evidence says actually helps, and how to know when it is time to reach out. Let me start with how common this really is. Anxiety is the most common mental health condition in Australia. The Australian Bureau of Statistics found that more than 1 in 6 Australians had experienced an anxiety disorder in a 12-month period. That is around 3.5 million people. It is even more common among women, and strikingly high among young adults, where it affects close to 1 in 3. So if stress and anxiety have become unwelcome companions, this is not a personal failing. And it is not a sign that you are coping worse than everyone around you. The truth is that everyone else is quietly wrestling with it too. Now, stress and anxiety are not the same thing. Even though we tend to use the words as if they were, there is a useful difference. Stress is usually a response to a specific, identifiable pressure, a deadline, a big bill, a house move, a hard conversation. It is your body gearing up to meet a demand, and it typically eases once the demand passes. In small doses, it is normal, and it can even be helpful. Anxiety is more about anticipated or imagined threats. It is the mind running ahead to what might go wrong. And it can linger even when nothing is actually wrong right now. That is why you can be safe on your own couch and still feel your heart racing. Both are part of being human. The problem is not feeling them. The problem is when they become chronic, always switched on, out of proportion, and getting in the way of your sleep, your work, your relationships, and your enjoyment. So when does it tip from normal into time to get help? There is no need to wait until you're at breaking point. It is worth reaching out when stress or anxiety is persistent, there most days for weeks, rather than passing with the situation when it is distressing, genuinely uncomfortable rather than background noise. When it is interfering with your sleep, your concentration, your mood, or your work. And when it is driving avoidance, so you find yourself shrinking your life to dodge the things that make you anxious. That last one matters more than most people realize. And it brings us to why therapy works. When something makes us anxious, the natural move is to avoid it. Skip the event, dodge the phone call, stay home. And it works. For about an hour, the relief is real. But it is short. And it comes at a price. Every time you avoid, your brain quietly learns that the thing really was dangerous, and the fear grows a little stronger. Avoidance is the fuel that anxiety runs on. Good therapy does the opposite. Instead of feeding the fear, it helps you turn towards it, safely, gradually, and with skills, so your brain can learn a new and truer lesson. I can handle this. Which brings me to the therapies that actually help. Several evidence-based approaches are used for stress and anxiety, and a psychologist will match them to you. Cognitive behavioral therapy, or CBT, has the strongest research base for anxiety. It helps you notice the thinking patterns that crank anxiety up, the catastrophizing, the mind reading, the what-if spirals, and test them against reality, while you gradually face the situations you have been avoiding. It is practical, structured, and often relatively short-term. Acceptance and commitment therapy, or ACT, takes a different angle. Rather than fighting anxious thoughts, it teaches you to unhook from them and keep moving towards what matters to you. Mindfulness-based approaches train the skill of coming back to the present moment, instead of being dragged into the future your anxiety is forecasting. And where anxiety is rooted in a past frightening or traumatic experience, EMDR may be considered. You do not need to know which one you need. That is my job to work out with you. There are also things you can start today. Move your body. because regular exercise is one of the best evidence things you can do for anxiety. And a walk around Lake Norwest counts. Protect your sleep. Breathe slowly. With a longer out-breath, get outside into green space and set some boundaries. Because not everything is truly urgent. Think of these as first aid, not a cure. When anxiety is persistent, they work best alongside proper support. If stress and anxiety have outstayed their welcome, talking to a professional can genuinely change things. At Potentialz Unlimited here in Bella Vista, a first step is simply a conversation. With no pressure and no commitment, you can read the full guide or book an appointment using the links in the description below. Serenity in the city is possible, and it usually starts with reaching out before you go. Here's a quick recap of what we covered: how common anxiety really is, how stress and anxiety differ when it is time to get help, why avoidance backfires, the therapies that actually help,